Kia ora koutou, welcome back to the last lecture for the cardiovascular system. So we're going to move on to condition number 2 that relates to the cardiovascular system, and we're going to talk about congenital heart failure. So what you need to know about it, also known as congestive heart failure, it is where the heart becomes weak or stiff and stops pumping like it should. So, after having gone through the lecture and understanding the complexity and all the things that need to work properly for that cardiovascular system to function and to get all of our cells the oxygen and nutrients that they need, it's really important that the system works well. So what happens in this condition is the muscles in the heart thicken, which affects how well it works, and the blood starts to back up. And causes fluid building in the lungs, okay, which isn't a great thing because fluid in the lungs means that gas exchange that we'll talk about when we kind of move on to the respiratory system, that transfer of oxygen and CO2 in the lungs and the alveoli isn't able to happen as it should. So that has implications for our health in terms of all our cells and their function if we can't get that oxygen in. Okay, so a really serious condition. Can be caused by other diseases. So, for example, coronary artery disease. So that's a narrowing of the lumen or the holes in those blood vessels, and high blood pressure is another one that can contribute to that. So patients that have less blood supply and less ability to use the lungs, essentially. So it may become short of breath or easily have problems performing basic tasks. Okay, so getting breathless, going up a couple of stairs, getting up and down out of a chair, kind of getting in and out of a car. Obviously your ability to transport oxygen, if it's impaired because of this, even the most basic tasks would become challenging and problematic. Okay, signs and symptoms that you may see. So first one, and probably the most common, shortness of breath when with activity or when lying down. So that's one that you'll see with a lot of conditions. It'll tie into the next one there. So fatigue and weakness, again, when you can't get that oxygen into the body and the nutrients in, and kind of get the waste out on the flip side as well. That becomes really problematic. So then we talked a little bit as well about swelling. So in the legs, ankles, and feet, you'll see that very commonly. Rapid or irregular heartbeat, obviously because the heart's not functioning the way it's meant to be. Reduced ability to exercise. Obviously the heart and the cardiovascular system and the respiratory system are really important in terms of our ability to be able to perform exercise. If you're seeing persistent cough or wheezing, again, that's a symptom that you may see with many conditions, and especially when we talk about a couple that will link to the respiratory system as well. But the thing that may be different here is the white or pink blood-tinged mucus that they're coughing up. That can be a sign that this is what's going on. Swelling around the abdomen, rapid weight gain from fluid buildup, again, so we can't effectively move the waste out of the body, so it starts to build up, and potentially chest pain if it's been caused by heart attack. So if, again, it's linked to heart attack, cardiac arrest, linked to coronary artery disease and high blood pressure that have kind of built up to an event like that, potentially can be linked there as well. Here we go. So by gender and ethnic group, at the year ended June 2020, you will see there that, again, relatively common in all ethnicities. Not so much in the Asian community, but Europeans, yes, Māori women more so than men, and Pacific and the European much more common in men, and it kind of linked to those causes and those symptoms. So cardiovascular disease as a whole, you're probably going to see this more often in those populations that are more likely to, or showing higher incidence of those other cardiovascular conditions as well. Okay, how can you prevent it? Good question. Not smoking, really good start. Controlling conditions, so getting on top of things like high blood pressure and diabetes. Ideally not just medication, but lifestyle. So, kind of finding that balance between eating kind of whole, less processed foods, doing more exercises, being more active, maintaining a healthy weight, and reducing and managing stress. So kind of balancing all of that stuff out. All of those lifestyle factors will impact on how that cardiovascular system works in terms of efficiency and effectiveness. So the fitter and the stronger you are, the better nutrients you're putting into your body, the closer you are to a weight and a stress level that's not going to overload that cardiovascular system, the less likely you are, to have those issues. All right, thanks very much. We're going to leave it there. So pop down below, have a look at the quick quiz. It's got a couple of questions about these conditions, and then so the next item on the agenda after you've had a look at that is we'll move on to the respiratory system again, which is very closely linked to this cardiovascular system too. All right, so enjoy, and we'll see you again shortly. Ka kite.